The TCC EZ Total Contact Cast System provides the healthcare provider with a primary dressing and the necessary components to apply a total contact cast. It is important to put tape over the distal edge of the wound dressing so that when the stockinette is applied, the wound dressing does not roll up. We pull the stockinette over the entire foot, extending to the knee. We try to avoid disrupting the tape and the dressing in this process. At this time, we smoothly fold the excess stockinette over the dorsum of the foot and secure with plastic tape. Leave 1 to 2 fingers at the end of the toe so they will not be impinged. And then at this point we can cut excess stockinette on the dorsum of the foot. Apply the protective felt padding. We align the circular flaps over the medial and lateral malleoli with the shorter or narrower portion directed towards the knee. We use plastic tape to secure circular pads to the malleoli, then tape along the tibia. Do not circumferentially tape around the leg. Loosely wrap the remaining protective foot padding to cover the toes and the plantar surface of the foot. Leave a finger's width space beyond the longest toe to ensure again that the toes are not impinged. Cut any excess padding to allow for approximately 1 to 3 inches of padding behind the heel. For a narrow foot, trim the corners of the heel for optimal cast contact. Starting with a 2-inch fold, roll the sleeve into a donut shape. Place the sleeve over the toes and unroll the sleeve extending towards the knee, leaving 2 inches of stockinette exposed. Pull the sleeve distally, leaving approximately 2 to 4 inches of excess beyond the toes. At this point, ensure that all existing protective layers are not being disrupted or binding the toes. Loosely fold excess sleeve over the dorsum of the foot and secure with plastic tape. Cut the excess felt padding at the knee, even with the white protective sleeve, and fold the stockinette over the white protective sleeve. At this point, the patient preparation stage is completed, and we'll move into the second phase, which is casting. The optimal water temperature for applying the cast and activating the cast is 70 degrees Fahrenheit to 80 degrees Fahrenheit. Cooler water will negatively impact the activation process. Warmer water will cause the cast to harden faster, but if too warm, it will weaken the cast. At this point, the foot is bent at the knee. The leg is perpendicular to the ground, and the foot is at 90 degrees to the ankle. We take the wrap with the cast material, open it up on the side, and pull the cast material out. You can see the cast material has the honeycombs and the openings that will open up to conform to the size of the leg. Like the cast protector, we're going to roll this up like a donut, and oftentimes we'll rotate it like a steering wheel to make sure all the bites are equal. There are two lines. Usually we put the line on the front of the leg to show where we take off the cast, and the other line will be on the back of the leg. We like to leave approximately 2 inches extra hanging distal past the toes. At this point, we take the cast, we dip it in the water for approximately 5 to 6 seconds. It bubbles, and when it stops bubbling, you know it's saturated. We take it out of the water, give it a couple of shakes, and a very light squeeze. Squeezing it too hard leaves all the resin and the catalyst on the bottom. We bring it to the foot, we give it a little stretch, and we start applying it over the toes. And as we apply it, we utilize our thumbs to help pull the cast over the toes and then up the leg. The cast is applied proximally to the widest part of the calf. We roll it to tighten it up at that point. We assure that the foot's at 90 degrees, and then we rub it to get contouring to assure we have a total contact. The more you rub it, the warmer it gets, the more the catalyst and the resin become activated. You can hear the cast do snap, crackle, and pop as it's setting. It's already getting warmer. We want to rub the cast for 3 to 5 minutes and ensure there's contouring from the ankle all the way proximally to the widest part of the calf, all while maintaining the foot at 90 degrees to the leg. Sometimes we need to add additional water to assist in the activation process. A staff member must always be present while the cast is getting hard to ensure that the foot is 90 degrees to the leg. The appropriate way to hold the foot is with your hands on the malleoli, not pushing against the cast, fingers up, thumbs down, holding the foot at 90 degrees, but not dorsiflexing the toes to do it. Because when you dorsiflex the toes, you plantar flex the metatarsal heads. After the cast sock has cooled and it is hardened, apply the outer boot. This is approximately 15 to 20 minutes after casting. Place the hardened cast between the upright struts of the walker boot. Ensure that the struts align with and are parallel to the patient's tibia and fibula, and place the heel at the rear of the boot. Adjust the top straps so they are snug around the patient's leg. Instruct the patient that these straps must be snug at all times. Restrict ambulation for 24 hours post-casting application, as the cast does not fully cure for 24 hours. Instruct the patient that the outer boot must always be worn for ambulation. Ambulation without the boot will cause instability, potentially damage the cast, and delay progress. Charcot patients must wear the outer boot at all times. To find out more information about TCC EZ, look at tccez.com, our patient website, tccpatient.com, and all of the application videos are on the YouTube channel TCC EZ.